What if you could take that risk, make that change, reach that goal, live your best life? Welcome to another episode of the What If You Could podcast, where we get together with amazing experts and everyday people who share challenges, encourage healing, and explore the possibilities that life has to offer. I'm your host, Gary Scott, and I'm excited that you're along for the ride. Hey, everybody. Welcome to another episode of the What If You Could podcast. And today, my wonderful guest is Greg Vigdor. Hey, Greg, how are you?
Doing great. Great to be with you.
Right on. He's got a guitar in the background, so if this gets boring, he's just going to start ripping out some tunes. So,
That's right.
either way, you guys are going to love this podcast. All right, I'm just going to go ahead and read Greg's bio real quick, and then we're going to jump in the pool. With over 40 years of leadership roles and experience in improving health and healthcare, Greg Vigdor is uniquely positioned to offer up practical ideas for how America can fix its broken healthcare system. Greg has served in a variety of health leadership roles, including as president and CEO of both Washington Health Foundation and Arizona Hospital and Healthcare Association. Now, as an author, sharing his insights about the system and how to change it for the better. Greg is doing this as a now volunteer president of the nonprofit Washington Health Foundation and the author of the Irv Tinsley Health Policy Detective Series. His recently released novel, The COVID Murders, received a Book Excellence Award for Medical Thrillers from Artisan Books Reviews and a top new release badge from Amazon. So I think Greg is uniquely qualified to save America from the disaster of healthcare. But before we get into that, we're gonna set Greg loose in a second. But because we're the What If You Could podcast, I always have one question for my guests, and then I don't bore them anymore. So, Greg, since we're the What If You Could podcast, do you have a What If You Could for us? Or what if you could do something? Or one day in your life you said, shit, what if I could do this? You have something you could share with us?
Yeah, so I've got a few, but I'll share a couple. The first one is that I became an author. That was a what if you could moment for me. Something I dreamed about when I was just a little kid, and so I just suddenly started writing. But the one I'd talk about that relates to the themes of my book is about healthcare and how to fix it. As I had fallen into the healthcare system as my career almost by accident. My dad was a hospital administrator, assistant administrator, so I grew up hanging around hospitals, and I just ended up getting career opportunities to do more and more, and kept getting more advanced positions. And um, you know, 30 years later, I was in a position where I had started up the Washington Health Foundation and had a significant amount of money in it that I had developed to try to do the right thing to improve health for people. And the what if I could moment was, well, what do I recommend we do with this? I had a lot of influence on where it went because I had created the money stream, and I had a lot of choices, but the two basic ones was, one is I could go sort of the comfortable route where I could be president of a thriving foundation for many, many years into the future, doing sort of important work, but not ground shaking work. Would just sort of be more keeping the system going the way it was and helping people. Or I could do something more and try to really change it fundamentally for the better. Because for all the smart, talented, and committed people in the healthcare system, as a system, it just doesn't work very well. And instead, I continue the earlier commitment in my career to, let's just really go all in, put the chips in, if I could, all in on trying to find the big changes that will really make a difference and transform the system, not just have it adapt so it can survive and marginally help people.
Well, good luck with that, pal. Have you had life threats? Have you had death threats against your life for trying to take a trillion dollar gravy train away from these people? I mean, when obviously status quo is not working. So, I mean, to blow this thing up, I mean, what were you thinking? Were you like, am I nuts or what to try to take this on?
Well, I was thinking I was nuts, but I've mostly gotten encouragement from people, including most people in the health system, including CEOs who understood the dilemma I was in making my choices. They said, like, I got into this to really make a difference, and I'm wondering what I'm doing. I'm kind of in a position now where I can't do that, and I really compliment you for trying to do what you're doing, as impossible as they'd then tell me they thought it was. They said, I it's good that you're trying because somebody needs to. So again, I've taken mostly encouragement from not only people in the system, but certainly patients and just regular folks just trying to figure out a complicated healthcare system. Once in a while in the political world, I take a little flack, but that's just what happens in the political world.
Yeah, do not separate politicians from their gravy train of massive amounts of money pouring into the politicians.
That would be
Um,
correct.
so when you're looking at our healthcare system, and I am not a guy to talk about it only because I lost my wife to cancer and it was just such a
Sorry to
complete
hear
shit
that.
show working with the insurance companies, and then I got cancer and I'm like, I think it's just easier to
Oh.
die. But when you're looking at doing this, where do you even start?
So for me, and your experiences are all too common. But I think it's part of the answer is that the only way to really find the true solution is to really build it around patients and people. Right now, our healthcare system is built around the providers, the insurers, the government agencies. It is structured and runs around those worlds and their interests. Not by any grand design, but that's just sort of the way it worked out historically for perfectly valid and understandable reasons looking back. But if you really want to unravel it, what you do is you go to the heart of it and say, we need a system that really deals with the unique needs of individuals and communities. And so that's a lot of the changes I try to talk about and I try to bring out in my books in sort of easily understandable ways, sort of get at that imperative of let's look at this from a different point of view of how a true system would build around the very unique nature of every human being and the very personal things that are affecting them.
Do you, can we ever get back to where a doctor shows up at your house with a little black bag and charges you $50 or takes a dozen eggs and, you know, helps your child, try to feel better? Can we ever get back to doctors just being doctors?
I think we can. Maybe not with the barter system or the eggs being enough to cut the deal because I think they have a view of their worth that probably is correct. That's maybe more than that now. Although eggs are kind of pricey now, so maybe I'm wrong about that.
Right.
Um, but you even see some examples of it. So there are there's threads of good all over the system. So one is it's something that's called the concierge health movement,
Yeah.
where people can sign up for concierge doctors. When it started many years ago, I was involved on watching it. The concierge is mostly you got, help parking your car. But it's really advanced quite a bit from there. And there's some concierge practices which are really getting at the heart of I have my physician who's going to spend a lot more time with me when I need him than the typical physician office visit, which is no more than 7 minutes, where you got to sort of learn what's wrong with something, even if it's something that person doesn't want to talk about because it's embarrassing, like a sexually transmitted disease, whatever. And 7 minutes just isn't enough time. Well, concierge practices are trying to flip that on its head and say that for a fee for service cost, some of them pretty pricey, we're going to sort of build the relationship you're talking about again. So it's not dead, and there's something there, but certainly the system is not orienting itself around those concierge practices. It's sort of catering to those with the resources and knowledge to be able to find that relationship and build upon it.
Yeah, I've been embarrassed about my sexually transmitted disease for a while, and I try not to share it with too many people. But, I've got some very wealthy friends, and they probably 90% of the people that I know with a real high net worth have dropped out of the insurance completely and have a concierge doctor.
Yep,
They
yep,
have them like their attorney or their CPA or whatever. It's like, I've got my doctor, I pay him a retainer. When I need them, they're there. They come to the house or I go see to their office. There's not even a waiting room. You know what I mean? They're not a bunch
right.
of people sitting
Yep.
in the waiting room. I just walk right in to see my doctor. I get all the time that I need. It's not the 3 minutes and then you get the PA. So yeah, I think if we can make that affordable, it makes sense. The
Yeah, I think
I
there's a way to do that. And so you see the interest. So even when you go back to your question about what if I could with the Washington Health Foundation, a lot of what we did back when I made that choice was to build something we called health homes, which was a
you
set of,
had wait had what?
we build this program in the foundation called health homes.
Health homes.
Health homes.
Oh,
And
okay.
the concept was just that for people that couldn't afford to find a concierge practice and pay that what you're talking about, that there's a ways for people to empower people to take control of their own health and build the system around them. So we even built a number of free tools that are still on our website of how people can do that. And the notion is making it more accessible to people that can't afford the pricey cost of a concierge physician. So it's possible to redesign a system that way. You just got to sort of get creative about it.
Well, I think you have to get the insurance companies out of writing our healthcare policy. I mean, I heard something
Part
the
of it.
other day that was kind of shocking to me. Now, I during my cancer diagnosis, I went to the doctor a lot, right? And because I had finally got insurance, I dropped insurance for 10 years after my wife's passed because I said, "You guys are worthless. I'll just take the chance," right? Um, and so when they'd go in, sometimes they'd take my $15 copay, and sometimes they'd go, "Oh, we'll get it later, or we'll bill you, or whatever." Well, a couple times I've gotten like just hate mail for my $15 copay and constant calls and stuff. Like, God, guys, it's $15, right? You probably got $4,000 from my radiation treatment. What's the deal with the $15? And then I heard, and you can maybe straighten me out if this I'm wrong, that some insurance companies will not pay a doctor if they didn't collect the copay because the doctor can't prove that the patient was actually treated. And so that's why the doctor's so rabid about going after the $15. I mean, do you use that in your wheelhouse at all? Do you know, is that true?
I've never heard it put quite that way. I mean,
Mhm.
I think a lot of providers would prefer not to collect that money, especially the $15 copays, but it's sort of ingrained into the system that that's part of how the whole contractual relationship works among these parties that are unequal power relationships. So I think the providers are probably more cognizant of not wanting to be disqualified for the panel. Maybe that's the basis they would sort of through the side door say, well, you're not honoring your contract, which includes collecting copays from these people. But it's all built on a lot of myths and a lot of control and power relationships that again are not central to healthcare and the health of the person, but to the system perpetuating itself.
Yeah. You know, when I first saw you pop up and I was looking through this. I go, the dude picked COVID? I mean, the last thing you want to write about or put anything out in the world, unless you do want to be put in jail, is to use the C word. Um, so I was like, oh, I got to talk to this guy. I love this guy already, man. Um, so in your books, you've got the Irv Tinsley Health Policy Detective Series. Now, I mean, when I started doing podcasts, I'm an author junkie, right? You can tell I love books. So I've tried to always get people's books before they came on, but it's just I do so many, it's
Right.
getting
That's hard.
impossible, right? So I'm sorry I haven't read your books. So what is the first book? The Theory of Irv. Who's this Irv dude?
So Irv is the hero of my series. Let me sort of generally describe what these books are. Is having spent 40 years of my career within the healthcare system and political world trying to change the system, after my last job, I said, well, maybe there's a different way to do this that I could sort of educate people. And the idea is to write entertaining medical stories, medical thrillers, and mysteries, and use people just reading these books for entertainment purposes, and then inserting into them these real questions of health policy and helping to educate people and bring them into a broader dialogue about what are the solutions for our healthcare system. So that's the notion. So the first book was The Theory of Irv, and at the heart of it's the theory of Irv is Irv finding his way within the healthcare system as a career professional and really finding his commitment to life of being of service to others as his central purpose. And but meanwhile, he's in the middle of this thorny mystery around healthcare, something that looks like a pandemic. I actually wrote this before the pandemic, but turns out to actually be something far, far worse and sinister. really relating to transactions about trying to get illegal immigrants out of the country using the healthcare system.
Dude, you wrote all this before all this happened?
Before it all, yeah.
Did the CIA and FBI show up at your door? They're like, "Hey, we've
I
already got
sort of
this
heard.
plan. Don't blow this for us."
I hear clicks in my phone a lot, so I'm just guessing that's who it is. But
Sorry.
yeah, that's the idea, is just sort of use something that's entertaining to make my points. And the theory of it's a fairly long book because originally I was also going to write a policy book, sort of explaining what I knew about health policy and how to fix it. And I found that was boring me. So I sort of put the two together and used historical fiction to try to tell the tale of why American health policy is so screwed up. And so it's more of an entertaining way to understand that as well. The second book, The COVID Murders, is more of the same but shorter, as I realize that I want to get it to be more fiction oriented. So the entertainment is really drawing in, and I can sort of reinforce my central points about healthcare. And I actually settled on the COVID Murders title because the theory of Irv was kind of it meant something to me, but it didn't really explain much to the regular person about what was going on. I said, I'm going to get something more sensational. And you're right. At times I regretted that. For a while I couldn't advertise it because I was getting accused of doing things I had no imagination that I could even think about doing those. Because really the COVID murders is really not about COVID murders. It's really just about the time where we went through this thing that people described it as the COVID period. Whether you believed in it or not, it was almost irrelevant to what I was talking about. It said it was just a time period where something
Yeah.
else was happening in a hospital, another medical thriller where somebody inside was perhaps killing people intentionally. So again, that's, and my stories, they're page turners and they're exciting and interesting. My latest one is Death Panels, another one that I'm hoping not to get in as much trouble with the title out, but is sort of getting to some major questions about what happens when you go to a healthcare institution and what are they really doing for you.
The death panels.
And Death
Dude, are
Panels.
you trying to get put in Gitmo? I mean, are you trying to get kicked out of the country? Listen, I this is how bad the death panels are. Okay, for people who don't know what the death panels are, in Obamacare, they decided that a doctor wasn't smart enough to know what to. You'll straighten me out on this because I'm sure I'll screw this up. So please straighten me out on if I screw this up. My experience with the death panel was, though, Obama decided when he let the insurance companies write the healthcare system that he'd have these panels that your doctor would say, I need my client, my Gary's wife to get this treatment because she's got cancer. And then they'd send it to the insurance company, and the insurance company would send it to the death panels, and the death panels would reject it, and then my wife would die. And so I received a letter 6 months after my wife passed. I should have kept the letter, but I was so mad I burned it. It said, "Oh, we don't think that your wife needs this treatment, so we've denied it." Like, well, she's been dead for 6 months, so thanks for
Mhm.
checking in. But so please straighten me out on this death panels now. How far off am I on what's going on with what the death panels are?
So you kind of got it right as to how it was described, but that was completely wrong. As somebody who's quite involved in the Affordable Care Act, Obamacare debates, what it really was a political talking point. And really what it came out of was a very small provision in I think it was like 2,000 pages of stuff. And it
At
was
least,
really
yeah.
about helping physicians being able to do more referrals for end of life care, which would allow people, it's something I got quite involved with in my last job, of helping people who, most people are like this, would prefer not to die in a cold and foreign hospital, but in their own bed. And there are ways to do that, but you need to basically have the equivalent of a prescription and the support mechanism to be able to get there. So what the provisions in the Affordable Care Act were just really helping to that to happen. But it was more convenient politically to have a major bombshell out there in the political world that says Obamacare is about creating death panels, and the way we're going to save money is by killing people. My funniest story about this, when I really learned about this, was I got invited to give a talk in Montana. For then Max Baucus was the head of the Senate Finance Committee, and I did a lot with rural health. So he brought me out to this forum in Montana, and I flew out there, and it was right when all this death panel stuff hit and the lobbying began on it. And so I'm walking to this conference. I think we were in Bozeman, and suddenly I walk. There's like this huge demonstration outside of the conference hall, because they figured out he was hosting this meeting. And it was people sort of like holding skeletons, dressed as skeletons, and sort of I had to walk through this sort of death panel grouping to sort of get to where I was giving my talk, and then I had to walk through them on the way out. Well, the funniest thing was that night I'm at my hotel before I flew back to, I was living in Seattle then, and I run into all these people in the hotel bar. And it turns out most of them weren't even from there. They had been
Of course.
flown in to basically go do a demonstration about death panels.
That's so crazy, man. I mean, I mean, that's how it's been the last 4 years. I mean, you go to a BLM march or an Antifa or a Life Matters thing or whatever. You go, hey man, what do you think about this? I go, I don't know. I'm just getting $15 an hour. I don't even know what my sign says. It's so bizarre that you ran into that, though, right?
It's a
But
strange world we live in.
yeah, it's just insane. So then when and not to get political with different presidents' names and stuff, but just because it happened, I thought under his watch, but Trump got in and was approving what the end of life thing or where people can actually get to go, look, I'm out of here, right? I'm not going to make it. I don't want to die like this. I'm going to take something and kill myself. Kind of like a Kevorkian type thing. Is that what he did? Is that what came about with end of life stuff?
I don't think any president really waded into it after the death panel thing of the Obamacare. And so it became actually more private initiative. So I was the CEO of the Arizona Hospital Association, and I started an initiative in our world where we wanted to make this path easier for people. Again, navigating the dangerous message that it's embedded in, but finding a way to make sure that people could die where they preferred to die. And there are movements like that in other states and then across the nation. So there is sort of a death dignity movement that's growing. That's not necessarily assisted suicide. There are some flanks to that which complicate messages, but there is I think, a beginning of an awareness that it's what people prefer. It's also incredibly cheaper. It's a
Yes.
secondary thing. You try to keep that thing, the notion about saving money. It's that we're spending tons of money on people who don't want that care, who want to be home with their loved ones and their dog or whatever it is, and can sort of find their next whatever it is with peace of mind, and that it's about them and not about a system just sort of cranking out more procedures for someone who's on their way out.
What is two quick questions, and I'm gonna write one of them down so I don't forget. Um, what is I know it's a high percentage, but what is the percentage of costs that we spend on people in that last year, 6 months, 3 months of life? Isn't it like a massive percentage of the entire healthcare?
Yeah, I'm blanking on the actual numbers, post-holiday syndrome, I think. But it is like we spend like, 3/4 of our money in the last 3 weeks of life because of
Yeah,
exactly what I was describing.
yeah.
Sometimes legitimately, but a lot of times it's just an inefficient use of resources when it's really clear what's happening, and there's just a spinning of more and more stuff that needs to be done. The classic instance of somebody falling and breaking their hip, and then a hospital-based infection, and then just on and on and on, and the end of it, um, they're dead.
Yeah, and like my wife was adamant about having a do not resuscitate band
Right.
on her arm, just for that reason. She's like, I'm not going to sit here as a vegetable for the next 30 days. If I'm gone, I'm a goner. Don't bring me back. But I wanted to touch on kind of how hospice plays into that because I've had a number of close friends of mine. My wife unfortunately died in the hospital, which really sucked. But hospice is a pretty incredible thing. But having been kind of close in the hospice, like being there in the last couple days, they're literally ending your life. I mean,
Yes.
they're jacking you up pretty hard on the morphine or whatever, and they're slowly putting you down, right? I mean, hospice is a pretty amazing thing. Those people are angels, man. I mean, they do an amazing job in the hospice. Who pays for hospice?
Yeah, so it's a payable benefit now. And before, I don't know exactly when it changed, but it was something that was done more on a voluntary basis with nurses. Visiting nurses associations would tend to be the hospice nurses. And you're right, when it's done right, which it is very frequently, it's just an amazing thing. Sort of a godsend for the people involved, not only the person, but the family around them trying to navigate this. There are more, I think, hospices that are proprietary in nature out there now than there were back then. So there are some cautionary tales out there about how this also might be something you got to be careful about, and sort of invokes the need to get government, other safeguards involved. But as a essence and a concept, hospice, just amazing possibilities and practice for people who really need help at the most vulnerable time in their life.
Yeah, and it helps out the family so much. It just makes things so much gentler, so much easier, so much less cold and ugly. And now I want to jump back in your books because they're super interesting about your books. But I do want to just dive into the ugly underbelly guts of the healthcare system. And you talk a lot about wanting to try to implement change, hoping to spearhead change, obviously, being a volunteer president of a not-for-profit Washington Health. I mean, last year the insurance companies brought in $1.5 trillion in income, and here you are volunteering your time to try to do big work. I mean, that's kind of not fair. I mean, what's the deal with being a volunteer president of the not-for-profit Washington Health Foundation?
Well, it's just my life's purpose is to do good for others, and that there's a time when I was a paid president of the Washington Health Foundation. Washington Health Foundation doesn't have much of any money left, so now I do it for free. But the service is still the same, and I think there's a lot of other
What is
people
the
out there.
service? What is the service that they do?
Well, right now it's not much. We used to be a very active foundation, intentionally spending down our reserves for good. But this 10 years ago, we pretty much ran out of money. We have less than $30,000 in the bank now, which we use to basically to just sort of stay alive.
Well,
But
what did they
there's a,
do? What is the what did when it had go and it was actively doing stuff? What did it do?
So in our heyday, we had like 50 employees and spent $8.5 million a year doing a combination of things that would try to make healthcare work better for people in smaller ways and big ways. So the smaller ways, we had a very active service in the Seattle area where people could call in to get help because they needed insurance and they needed to see a physician. And we would have caseworkers who would help them find the match. And maybe if they needed to, we'd help them get to their physician visit so we could get physicians who would agree to see them because they knew that client would show because we were helping to make sure they got there. We'd have a series of programs. We did a lot of work in the rural areas of Washington, grant making organization. We provide not huge grants, but sizable grants to rural communities to somehow find ways to build health in the community, whether it was sort of somehow dealing with, food issues or sewage issues or dietary issues or healthcare system issues. We'd find ways to help them there. But then we also had another flank, which was a lot of the work I was leading, which was how do you really build a consensus approach to building health policy in a new way that would redesign the system. And again, built around more about bringing people together and finding agreement rather than getting caught up in the political nonsense and the divides. So we had the highlight of it all was something we called the Healthiest State in the Nation campaign. And the proposition was the big vision of can we make
Wait, what
Washington
was that called?
the
What was that called?
healthiest state in the nation campaign. And
Healthiest.
the
Okay.
idea was we're in Washington State, so could we make Washington State the healthiest state in the nation? And we created a campaign to engage people and organizations to work toward that vision together. And it was just all assortment of different things. But it was, again, the notion was by thinking that way, you can transform a system instead of just sort of creeping along as we were doing with a lot of our other work of just sort of marginal improvements, helping people find things when they really needed it. But this would be our flank for trying to say we're going to fundamentally change the system for the better.
I can see why this has run out of money because it makes too much sense and it would remove governments and other middlemen out of the system. So it made too much sense. So you have to get rid of it. Now, why wouldn't the government who spends ridiculous amounts of money, why wouldn't the government get behind this? Because the government is so horrible about running anything, right? Why wouldn't they get behind an organization like this and say, you guys will save us hundreds of billions of dollars by streamlining this for us?
Yeah.
Why is this something that now has to become nonprofit because you're out of dough? I don't, it seems to me like this is a brilliant thing every state should do.
Yeah, I thought we'd be able to finance it for, we did it for over 5 years with our own money. And I thought at some point we'd find not just government, but others who would say, hey, this is good. Let's sort of put some money in and help fund this thing. It never really happened because everybody went to their own self-interest within that. And in government, it was also tinged with the, well, what if we're not successful? What if we're not the healthiest state? I'm going like, you know how much time I spend worrying about that? None. It's all about
Exactly.
trying to,
None. We got everyone in our state 100% healthier, but we're not number one. So we got to shut it
yeah,
down, man. We got to shut the whole
yeah,
thing down. That's nuts to
yeah.
me. I mean, it's nuts
It-
to me. I mean, it's there. You know better than me, right? I am not an expert in any of this. I'm just talking out my ass. So please don't ever hesitate to correct me. But I mean, if the insurance companies bring in $1.5 trillion a year, we spend $1 trillion a year in government. The waste inside all of the state, Medi-Cal, Medicare, those types of things is astronomical. So why can't we get behind something like this that will pay for itself 100 times over? Who really doesn't want this type of program?
I think sort of the self-interest of people where they are in the current system. The government sort of has their own unique angle, but I think a lot of people in the healthcare system are sort of, it works the way it is, and if we change it, then where am I going to be when that happens? It's the tough thinking about change and why people are uncomfortable with change, and it's why we need answers to somehow sort of break outside of the typical molds and outside of the typical politics too, because a lot of what those groups do now, and I used to be part of this in my working days, was sort of reinforce the political world and the money that goes into support particular points of view, which are usually about don't change this because I might get hurt by it. So we got to somehow get out of the box, and that's what a lot of the work at not only my foundation was, but the books that I'm writing, I'm trying to bring that theme through again in an entertaining way, not a lecture people kind of way.
Why do we still call it the healthcare system?
Um, because it's the term that people understand it to be, because that's what it is. It's really a sick care system if we got more accurate about it.
Yeah,
Um, the
exactly.
Washington Health Foundation, we got one point it was, well, what should our name be? And I had suggestions it should be the Washington Healthcare Foundation. I'm going like, well, no, we want it to be the Washington Health Foundation because we aspire to health. And that's what we want to do, is we want to sort of deal with our better angels and our dreams and our optimism. Not, we're not just sort of here to produce healthcare for the sake of producing healthcare, even though most of the economy now does that.
Exactly. Right. So, what did you say your budget was? Your $8 million a year budget, or you had $30 million that you guys were playing with to get to try to get this done?
At one point, our annual budget was about $8.5 million. We had about $45 million in the bank at the height of our reserves. Um, we could run it on a lot less, and we did, and sort of stretched it out. But at some point, it's just too
So,
big
if
a
the
gap.
lobbyists, if the pharmaceutical companies spend, I don't know, $800 billion a year lobbying to Congress, lobbying the Senate, if you divided that up by 50 states, half a trillion dollars in lobbyists, man, you guys could do a lot of good work, couldn't you?
Yeah, we could. But here's the connection partly to my book, my author career, is when I sell books, the money goes to the Washington Health Foundation, not to me. And so my hope
Why?
is at some point,
Why?
so so we can eventually have enough money in the bank, which is probably beyond my lifetime right now, to actually start to rekindle our work.
You're way too good of a guy, my brother. You are way too good of a guy, my friend. So we've got the hero or the one main character. Is he throughout this? The Irv Tinsley is our main guy. Is he a doctor or who is Irv?
He's um just a rebellious guy who has a master's in healthcare, and it works in, he's problem solves in healthcare. So in the first book, he's a public health detective The second book, he's a hospital administrator because he's moved on to a different position. He kind of moves around, and now he's formed a health policy detective agency. But he's got around him a circle of friends, including his wife and a guy by the name of Johnny, who becomes a senator, independent senator from Washington State. So he's got these other co-heroes around him that again try to bring out the things that he's missing or his weaknesses because he's a flawed character, as all of us are. Um, so there's a cadre of heroes and villains.
Well, I know who the villains are. Love you making the senator independent, by the way. Well done, sir. Well done. Because in this world, someone would have closed the book just based on whichever side the senator was on. So
Exactly, exactly.
well done on that. So I, but I have to go back to the COVID murders. Now, I, I, I when you wrote the book, the first book, we were not in COVID. In the first book, you talked about a pandemic and you talked about illegal immigration, which both became true. But in the COVID murders, we were in COVID, right? Or were we coming out of it?
We were starting to come out of it. Let's go back to the first book because I
Okay.
had started the first book 15 years ago, but then I took another job and I just sort of put it aside. And when I sort of left my last job, I picked it up and read it and said, "Hey, this is not bad." And I had suddenly I had COVID time and I had a bunch of time and I said, "Well, I've always wanted to write a book, so I'm going to write it because I got nothing else to do." So that's what I did. And I thought it was just a one-off, like I'd have one copy printed and put it on my shelf and said,
I
bucket
wrote a
list
book.
done. I wrote a book. And then some friends read it and said, "Hey, this is pretty good. You should try to publish it." So that was where the beginning of this shift became, well, that's not just about one book, one off dream thing. It's about, can I build an author career? And so the second book was, well, what do I write now? And I found I had a lot of frustrations around the COVID period in all different directions. A little hard to sort of capture it all, but it gave me a platform to sort of get a few frustrations out by just writing about them. But also, more importantly, just sort of again start to explore how we can bring these solution themes out and try to advance the notion of getting people to think a little bit differently about how we not only have to solve these problems, but we're in this together and need to find our better angels together, not separately.
God, you're such an optimist. I love you. You're giving away money on the books to healthcare, and which is a quadrillion, quadrillion dollar industry. And you think we can all come together around COVID. You are an angel, my friend. I think we need to canonize you. You should go to
Uh,
see the Pope.
it could be
Um,
just delusional.
I'm working more on delusional. I'm sorry. I didn't want to say it. You said it, not me. I had to go. But so I'm not gonna I just have to ask your thoughts on COVID. I mean, I don't I know there's so many pieces to it and stuff, but do you have some sort of thoughts on COVID, how it was handled, what the deal is, what's going on with it? I mean, I don't know.
Yeah. So here's my frame. Important to understand it. When at the Arizona Hospital Association, one of the programs I brought in when I went there was basically coordinated disaster planning for hospitals where they and the communities of Arizona would come together when we'd face particular public health crises. And so there are all sorts of them, but really on the top of the list was that what I knew as a longtime health professional was that the chance of mutated viruses across the globe suddenly coming up and striking us like it did in 1918 and other points in human history was very real, and we needed to be ready for that possibility. So I had been through some periods where um, we thought it was that period. SARS would be an example of that. Turned out it wasn't. That's great. But so when all this started happening, I was going, oh my God, I was no longer at the Arizona Hospital Association. I just left that job. It was just time to do it. I was going to be there 3 years. I'd been there 6. And so it was all starting to unfold, but I still got a lot of the messages saying, this unfortunately could be the real deal. And he's showing some of these characteristics. And then from there, everything just first got bungled in terms of really horrible testing to even understand who had it where and when, to then all the messages that sort of completely dissolved into the political world of you're either for it or against it. My world experience is viruses are politically neutral. They're just they're going to do what they're going to
They'll
do.
kill anybody. Yeah, they
Yeah,
don't
and,
care.
and they
Yeah,
might not kill you at all, but sort of
right.
knowing what is what is kind of the basis of it, and then figuring out what to do, including common sense public health practices if it is the one, including especially if you find pockets where it's really spreading, and especially in a lethal form, where you'd sort of ask people to sort of make some personal sacrifices for a short period of time. But that wasn't the frame of any of this, on both sides of the contentiousness. It just became this world of masks against non-masks and vaccines against non-vaccines and crazy stuff that just had me just banging my head against the wall. And so, again, I got to bring some of that out in the COVID murders, even though the COVID murders isn't really about COVID. It's just about how the fact that this bad guy at the hospital was doing what he was doing was way easier to hide because everybody was so obsessed with COVID.
He was able to go under the radar because no
Exactly.
one
Yeah.
was paying attention to that guy.
Yeah. All he had to do was put
Yeah,
on the
yeah.
death
Have you
certificate.
ever
It
met?
was
Have you
COVID.
could put anything right?
Yeah.
He could just strangle people every day and put COVID. No one would even question it, right?
It's pretty much what was going on.
I don't want to know because we don't want to give away the story.
That's right.
Got to buy the book, people. Buy the book. So have you met my hero, Dr. Fauci? Have you ever met him?
I never met the man.
No. The great, great humanitarian, great American. So let's go to the third book now. So our third book is Death Panels.
Right.
You're such a glutton. I swear to God. But you know what? Listen, if anything's going to get your attention, it's going to be the COVID murders and it's going to be death panels. That's for
Mhm.
damn sure. And our buddy is still in it. Irv Tinsley still in the third one.
He's still in it. He's struggling a bit because he had a bad experience confronting death at his last case in Nashville around the COVID murder story. But a friend of his wakes up in a strange medical facility and has no idea where she's at, and nor does she have any recognition of this being the same type of facility she's been in for the last couple of years because she had been struck by long COVID. And it turns out to where is she and what is this sinister thing and how does it interact with Irv as he tries to get back on his feet, sort of as he sort of confronts his fear of death and where to go with that, along with the usual other exciting things I try to add in my books. So
The twists and turns
twists and turns,
and the villains and all the good guys and
really,
stuff
really
like
bad villains. The more you're right, you learn, you get better at it. You say, my villains are not bad enough. I got to make them even worse.
that. We like bad villains. I don't know. We're just weird people like that. So who's going to play Irv Tinsley in the series when Taylor Sheridan offers you $100 million for the book series?
Yeah, my wife and I have been debating that. I've suggested Brad Pitt, as she's sort of thinks maybe I'm overshooting, but
Come on, why is it always Brad Pitt? Just because
I
he's
know.
damn good looking, he's such a handsome son of a. So who does she want to play?
Well, she wants to be Irv's wife, and I
Well,
keep
because
telling her,
Brad Pitt's the husband,
yeah,
of course she
there you
wants
go.
to be his
There,
wife.
there you go.
My wife wants to be Brad Pitt's wife too. I mean, come on, it's Brad
Doesn't make
frickin'
me
Pitt.
feel very good, but
No, it doesn't make us feel good at all. That's why I was thinking I had a not a Columbo type guy, but I had kind of a more of a scruffy, kind of disheveled kind of guy in my mind. I think of Brad Pitt and I'm like, he's too pretty. I don't want I
yeah,
want a guy who's disheveled and been through the mill and that type of guy. Like
yeah,
I don't know who. I don't know any
yeah.
actors,
Think we can
but
get Brad Pitt in a raincoat?
yeah, you can put Brad Pitt in a raincoat. I actually like Brad Pitt. I mean, I don't like many Hollywood people, but I actually think Brad Pitt's kind of a cool dude, and I think he's sober now, so he straightened some stuff out. But um, uh, now on the other side of it, now, so you've paid your dues in the medical industry. You've seen the nightmare that is healthcare. You want to kind of try to save American healthcare, or at least do something with it because it's complete boondoggle. So you've got these books. You've got it's a trilogy now, by the way. It's now a trilogy.
And half of the fourth is written.
Well, you know what's interesting is I interview a lot of authors. I am an author junkie. I'm a groupie. I'm an author groupie. Love authors, and I just love to read. I've always had since I was a little. As soon as I could read, it was my thing. And it's interesting how many have said, I wrote one book and I just was going to get this one book out, but during writing that book, another book appeared. The next book was already coming out before I finished the first book. So you to say, yeah, the third book's out, but I'm already working on the fourth book is not a surprise at all. You
Hmm.
guys could not help yourself. I mean, once you get that bug, right, you're just going with it.
Right.
You gonna tell us what the fourth book's leaning towards?
Well, so one of the things I learned as an author, and I self-publish, is that what I learned that there's almost no chance of being successful in your first book. That's like the equivalent of hitting the lottery.
Yeah.
But what it is, there's a method, and it's people who write a lot of books, and they write series. And if you write a series, that's really the way to even get into this. And
Hmm.
so, because you can basically bring back characters and people who like certain characters, and you get a following, and so the fourth is another in the Irv Tinsley series, but I'm introducing a new character who I'm trying to have him become the basis of a new series, so I can then sort of develop him. And he's kind of scruffy old guy who um, lives in Eastern Washington and is older than the hills, and we'll be able to talk about more historical things in terms of healthcare challenges.
I like him already. Yeah, a buddy of mine. He's become my buddy now because he I met him at a scuba show. He's an author, Nicholas Harvey, and he's on I think his 26th book. He
Yeah,
self-publishes
sounds right.
all of them, and his heroine is AJ Bailey, who's just a dive instructor who always ends up in some sort of kerfuffle somewhere. And they're great stories. They're great reads. But yeah, he had said the same thing. Having the series, and then you can do offshoots like AJ's best buddy, who is this person now, is kind of a character in a different series of books, and it can kind of spin off all over the place. But he told me that Amazon has 12 million books on it.
Yeah.
12 million books. I mean, so like you said, the odds of, unless you're J.K. Rowling's, I mean, the odds of just knocking one out of the park on a first book is really tough. But the self-publishing is a blessing now because it's so much
Yes,
better than going to these big publishing houses who really don't give a shit about a struggling new author, right? And so
that's right.
they don't really promote you like they should. Um, so I mean, what's next, Greg? I mean, what's next? Are you gonna still try to help the healthcare system? Are you still gonna try to get in there and see if we can blow it up? Or you just go like, ah, screw it, I'm just gonna write books?
No, I haven't given up yet. My books are going to continue to explore the health change theme until I sort of decide I can't do it anymore. I've been trying to sort of think about what it might mean with the Trump 2 administration, what the opportunities might be. I even wrote a free mini story that's on my author website for people to read as I'm trying to lean into how we might think about that in a very optimistic way. But again, I think at some point we're going to have to come to grips with it because it's just taking our economy over. I had one of my mentors used to talk about the growth of healthcare as a percent of gross national product. Gross domestic product is the term that gets used now. But when I started my career, it was 7%, and it was just a horror to think it might eventually get to 10%. This is back in the 70s. It's now 20% and still growing. And so I think one point I loosely said, well, that can never end. He goes, well, yes, there's a limit. And he goes, well, I looked at him curiously. He says, 100%.
Yep. Yeah.
Right. And that's
Yeah.
what I mean. At some point between 20 and 100%, it's just too much. You can't invest as a society in other things. So we're going to have to come to grips with this one way or another at some point.
Yeah, I mean, well, the two issues with that is number one, it's going to be 40% really quick, probably within the next 4 to 5 years. It's going to be 40%. But the bigger challenge is it doesn't do anything. I
It's
mean, it could
correct.
be 100%. You could literally spend 100% of the gross domestic product on frickin' healthcare, and it wouldn't matter because the system is broken, right? The
That's right.
system is just broken. So I have a what if you could question for you. What if you could? What if you were the dude and said, "Hi, I'm the Donald. I've heard a lot about you. I've read all your books. I've heard you're huge. You're huge. You're the greatest author I've ever seen. There's nobody better than Greg.
Hmm.
And he goes, I want you to take over the healthcare system. I mean, in just an easy kind of thing. I mean, what would Greg do if you were the king of the world healthcare guy?
Yeah. So I asked myself that question in my first book, The Theory of Urban. There's actually a 10-point legislative plan for what I would do, but it's sort of built around things that I think could happen. I'll just sort of give you a couple of examples, but one of my top ones is why don't we have a set of national health goals for what we like to achieve, and let's sort of have them be operative. And one of them would be a cost goal. And
One
I
of them
say
would be
that
a wait. One of them would be a what?
a cost goal, that we don't want healthcare in a given year to increase more
Oh,
than,
a
like, say,
cost goal.
right,
Okay. I'm sorry.
no more than 3% increase, which
Yeah.
would be a bonanza year in terms of the history of healthcare. And part of that is my understanding of the medical care system, which I grew up in. And what we know is it's sort of been always described as intractable. You can't move it. Well, what we know from experience is if you give the healthcare system, the medical care system, quantitative goals to achieve, they're absolutely incredible at achieving those things. So it's speaking a language that the medical care system will understand. If you started creating the right incentives to get the right care delivered at the right time, you want to have some quality goals around this to make sure you backstop it. The way you're not getting there is like with death panels, right? But just have, why don't we have national health goals? And I actually introduced this idea back during the Obamacare debate, and I sort of got the same answer I suggested before: is, well, what if we don't reach them? It's like, "Yeah, you're missing the point." So that would be one. Another one was, again, I talked at the beginning about wanting to create a system that's organized around the person. Well, we have the National Institutes of Health, and they have all sorts of different institutes within it, cancer, blood, art, whatever. Well, what if you had a patient-centered design institute within the National Institutes of Health, and put our best minds to work on how you would redesign a system so it really is organized around our people and not the providers and the insurers? Well, that could work. I
Yeah,
have a whole
that
host of
one's a
these.
brilliant one. Hello.
Yeah. Why don't we create a national health challenge like what John Kennedy was doing? Remember the physical fitness thing, and sort of build that up and sort of just have a, a 6-week period. Experimented with something like this with the Washington Health Foundation in Washington State, where people would compete to try to be the healthiest, and they'd have to learn what it means to be healthy, what they can do, both individually and together. There's ways to do this. It's a fun thing. We proved it was a fun thing when what we did in Washington State. We called it the Governor's Health Bowl.
Do we still have the presidential thing that they used to do when we were kids? I think Arnold took it over for a little while
He
under
did.
Bush.
I think it just sort of fell by the wayside, but I'm not really sure.
Well, because you're trying to get a kid who is completely unhealthy, who has zero interest in doing any of that, to do a push up. He's like, no. If I'm going to get up, it's because I got to go get some more Cheetos, another Mountain Dew, and some Skittles, and go back to my game playing. Right? I mean, it's like
Yeah,
to get these kids to move. I mean, our obesity crisis with kids is astronomical. So you know where that goes, right, Greg? I mean,
yep,
you're in this, you
yep,
know where it goes.
yep.
So that's what I'm saying. We're going to go from 20% to 40% in a blink of an eye because now
That's right.
20-year-olds are going to the hospital with diseases that we saw in 60-year-olds
Correct.
50 years ago, right? So it's like,
Correct.
so let me ask you a question. I mean, and I don't want to get off your list because they're all brilliant, but you made me think of something because you said his name. What do you don't I don't want to get political. Don't This is not a political statement, people. What do you think of RFK Jr. with him getting involved with our healthcare system?
Well, I'm scratching my head a lot about what to say about this because I want to write a piece, and I'm trying to just listen to hear a little bit more, because it's kind of Looney Tunes and wow, that could really work at the same time, right?
I
So
can hear the music now.
yeah. So what I mean, so part of this is that, there's things I believe in vaccinations as a scientific endeavor. There's a lot of them that are dangerous. There's some that aren't. So, but sort of casting aspersions at vaccines as a class doesn't kind of fly with me. That's kind of what's Looney Tunes to me. But meanwhile, I hear him talking eloquently about food additives and what is in our food system and why, which are a lot of agriculture incentives. Um, and this is an area we identified in our campaign in the Washington Health Foundation. We just looked at it and said, there's nothing we can do about that. So even the notion that he brought it up to me is like, wow, I haven't heard anybody talk about that other than Michael Pollan in years. And it's the right kind of thinking. If there's some gumption behind actually doing something about that, that could make a humongous difference in the health of America. Do I believe it'll happen? I can't say I'm there yet, but it's sort of an interesting thing to watch as these two different things sort of collide and bump around in the weird political process that is political nominations and approval by the Senate.
You know, it just seems like such a no-brainer to me, all right? You could love the guy when he's doing his RFK shtick, RFK Jr. shtick, and then you can hate the guy because he's doing the same shtick, but he's doing it with Trump. Because you hate Trump, you hate RFK Jr. now. Not you, but I'm just saying this is it.
Yeah, yeah,
And then you just say to yourself, okay, look, if you didn't know who the dude was, you put a bag over his head and he's an unknown
right,
comic, right? And he just starts saying, listen, if every country in the world has this stuff eliminated, why are we doing it here? If we can prove that this stuff causes these types of health issues, why don't we get rid of it? And so on and so forth. Everyone
right,
goes, that makes perfect sense to me. If all this stuff in Europe is different than all it is now, just read the label. You know,
yeah,
tomato sauce in Europe is tomato sauce with a little salt, right? It's
right,
tomatoes and salt. You read the label here, it's got 97 ingredients in the tomato sauce, right? And if he says, all we want to do is cut some of that back, everyone goes, that makes perfect sense. Oh, I got him. I'm totally behind it, right? Then you take the bag off. You go, oh my God, it's RFK Jr. I hate it. It's stupid. He's
right,
trying to kill
right.
us. Just like you said, you could hear the Looney Tune music in the background. So how do we bridge that? How do we bridge that, Greg? How do we get people to go, why don't you be healthy? Why don't we bring back the presidential exercise fitness thing? Why don't we get additives out of our food? Why don't we help children not be 100 pounds overweight and have a 75 BMI? Why aren't we doing this stuff?
Yeah. Yeah, so my premise is you got to find a way to bring these forces into something where you're collectively looking for solutions, not for divides, or you just got to kind of get it out of the political process.
Yeah.
So that's some of the notion of what I'm doing with my books is just find a way where this stuff will live and breathe, not in what candidates are saying or what politicians are saying or what anybody with a government badge on them is saying, wherever they are and whoever they are and whatever party they are. But we're just talking about health of people and how do we practically improve it because it affects us all in one way or another.
It affects us in huge ways. It's sucking up our budget. It's making our kids disgustingly unhealthy. It's aging us faster. I mean, there's just so many issues and so many challenges with why the healthcare system, why we can't get this done, right? It's just such madness. I love that you're addressing it through books. It's kind of trying to give you a little bit of sugar with your medicine, um, trying to get people to see something in a different light through an entertainment and enjoy the pain of looking into it.
Yes.
And you're on your 10 topics, and the 10 topics that you put, they're in your first book?
They're in the theory of Irvin. I repeat a lot of them in subsequent books in smaller doses where I can explain them a little bit more. Trying not to be too preachy about all of this, but the entire
Yeah.
formula is out there.
Yeah, we need it, but it's great that you could sneak it in there in the entertainment value. And then, a lot of it's like you said at the beginning, just somehow we got to blow this up because you can't just kind of keep tinkering around the sides because it's just broken. I mean,
Right.
it's so badly broken, it has to be blown up. The thing is, like you said, there's just too many hands in the pot. There's too
And
many people that are worried about covering their own ass. There's too many people about losing out on something. No one wants to step up and blow the system up.
yeah, and there's way too much money in it, reinforcing all that behavior. Way too much money.
Way too much money. Way too much money. So Greg, you've been awesome. I'm just so grateful for your time. There's so much more we can cover. You're very kind, and you're trying not to throw anybody under the bus here, and I appreciate that. I want to throw them all under the bus, and I want to actually drive the bus
And back it up.
because right? I'm just bitter about the healthcare system. I
No,
mean, I've just been through the ringer, and it's like that United Healthcare guy. I mean, should that guy have gotten shot in the street? Absolutely not. That's
right.
complete madness. But when you hear the kid's story and what was going on and how freaked out people are, I mean, people are like making this guy a hero. He's not a hero. He's a
Right.
cold-blooded murderer. But that's the type of anger and frustration that's out there around our healthcare system.
Yeah. Yeah. There's something like that can fester in somebody's mind around a system. It's not good news.
It's not good news. It's not good news. So, um, I do ask one last question, if I may, and it could be about your books, it could be about healthcare, it could be about your pet iguana, it could be about anything that you'd want to talk about. But I always ask people one last question: is there something you'd like to leave our guests with? A thought from Greg Vigdors is that means something to you. It says, "Man, I this is what I want people to know." Um, and any topic doesn't matter. But what would that be? What last thought would you like to leave us with?
Well, I would just like to know more what people are thinking. The biggest problem with becoming an author is it's much more isolating work than what I used to do. I used to see people every day. I'd give speeches, I'd, dialogue with people on email. Now I'm kind of in my office writing, or I try to get out and wander around. It's a little hard to kind of have that kind of interaction. And so I'd more like to know what people are thinking, and especially about the ideas that I'm sharing. So I just created a new author website, gregvigdor.com, and it's got opportunities to get my columns, learn more about my books, but also share your own thoughts about some of the provocative ideas I try to throw out there. So I just really like to know more and more what's on people's minds so I can sort of include that in this lonely endeavor that I'm doing of trying to think about a better future for others.
That's why Hemingway drank a bottle of scotch a day, my friend. It's
That's
just
my alternative.
that's what authors do. It's just them, their typewriter, and a bottle of whiskey, man. That's what you got when you're an author. But but I'm glad you brought that up because that's the last thing I just say is, Greg, how can people reach you? Where can they find you? We're obviously going to link your website, your books. We're going to link everything on the podcast. But just since we've got you, what's the best way to reach Greg?
The best way is gregvigdor.com, the website. So we just constructed it over the holidays, so I'd have a vehicle like that to just make it really easy for people to figure out where to find me and share whatever's on their mind.
I love it. I love it. Well, everybody, you have been given the gift of Greg Vigdor. He is the author. He has 3.5 books done. He's got the Irv Tinsley Health Policy Detective Series. Book 2 is the COVID Murders. I love it. And book 3 is what? The
Death panels.
death panels. Oh, he's going deep. He's been investigated by like the FBI, the CIA, the NIH. And we got a fourth book in the work, and I'm sure there'll be plenty more. And you're a super sweet guy. Love what you're doing. Volunteer, which is huge. Volunteer for the president of the not-for-profit Washington Health Foundation. You've given years of your life to the healthcare system. You're a one-man band. You're a one-legged paper hanger, and putting yourself out there. And I'm grateful that you came on, and hopefully we could spread the word and get people behind you and have you help us help ourselves.
I appreciate it, and keep on doing the great work with your show too.
Thanks, buddy. I appreciate it. All right, everybody. That was Greg Vigdor. That was another episode of the What If You Could podcast. Appreciate you guys listening, and we'll see you guys on the next one.
Take
See
care.
ya. Thanks again for joining us on another episode of What If You Could podcast. Please subscribe, like, share, and give us any feedback. We'd love to hear it. And remember, if you can dream it, you can do it. See you next time.